Now, from the News Channel 5 network, this is Medical Mondays.
Well, good evening, everyone. Welcome to News Channel 5 Plus. I'm Casey Mason. Thank you so much for joining us here for our Medical Mondays. And tonight we're talking about a topic that a lot of folks can relate to, chronic pain, specifically when it comes to your back. And joining us this evening, we have Dr. Satish Reddy joining us. Doctor, thank you for joining us this evening.
Thanks for having me, Casey.
We have a lot to cover tonight. First of all, you are with the Pain Management Group, right?
Yes, ma'am.
Wonderful. I would like to kind of kick off the show tonight to talk a little bit about, your expertise and the correlation we'll be learning about. You are an anesthesiologist,
yes,
and how that really relates to back pain.
Okay. So anesthesiologists typically can train an extra year in a fellowship to become board certified pain management specialist. The reason that anesthesiology kind of branches off into pain management is really because we do a lot of the same procedures. So people get epidurals for labor, which we do a lot for anesthesiology, but you can actually specialize out a little bit more and do epidurals in a lot of different places in the spine. So that's why pain management steps in, and there's a little extra training for that. We also use a lot of the same medications for treating pain acutely after surgery, and that branches off into chronic pain and how we use those medications for much longer periods. So there's a little bit of correlation, but it does take a little extra training afterwards.
Definitely. It kind of gives folks a background on, your story and a little bit about how that's going to relate to tonight's topic. And again, I mean, don't you agree this is something that I think a lot of folks tuning into tonight will have questions, maybe even some stories you want to share with us. And of course, this is free medical advice with the expert here himself. So I do want to go ahead and give you that number as we're kicking off tonight's show. The number there, it should be on your screen. I'll go ahead and give it to you here. It's 615-737-7587. Feel free to call in. We would be so happy to hear from you this evening. All right, well, doctor, let's just go ahead and dive into the topic tonight. Give us, an overview of exactly what is back pain, chronic pain, and just some facts about it.
Okay, so back pain typically is what people think about for low back pain or any type of pain that hurts in the back and runs down the legs, but you can actually have back pain in the mid back or in the neck as well. And in the neck you typically have symptoms that run into the arms, and in the mid back you'd have symptoms that can run into the chest wall, kind of wrapping around you. So most people typically have low back pain, but a lot of patients that we see have the other two as well. Back pain itself is probably one of the most common complaints in medicine today. I think 76 million people have pain acutely that bothers them for more than 24 hours. So that's 1 in 4 Americans. And pain in general is the #1 cause for anyone to access the medical system at all. So it's a very prevalent problem, and we see a lot of patients who need our help, so it's great.
Dr. Reddy, before the show tonight, we were just chit-chatting about tonight's topic, and we were talking really about how your back, I mean, it affects everything. If you have back pain, you have all over pain.
Yeah, absolutely. The back's job is to protect the spinal cord and give us support, and once things start sliding off or pinching those nerves, you can definitely have pain almost anywhere. So.
Exactly. And, diving into the Pain Management Group tonight, I do want to talk about, your practice. And we were also speaking tonight about when dealing with treatments, there is a bigger issue that does occur, and that is with, addiction.
Absolutely. So when a lot of people think about what is a pain clinic or why do you go to a pain clinic, people assume that it's mostly for opioids, but there's actually a lot more that we do, and really we like to think of opioids as kind of the small portion of what we do to fill in the gap for all the other treatments that we use. So I think what sets us apart at the Pain Management Group, and it's really one of the reasons that I decided to come to this practice specifically, is that we really have tools to treat an entire patient. So I always tell patients there's kind of like a toolbox that we have, and it's physical therapy is one of the tools, medication's one of the tools, and when it comes to medications, there's opioid medications, which is what people commonly think about, but there's also a lot of other medications that we call adjuvant medications, so muscle relaxers, medications to calm the nerves down if they're pinched or irritated, anti-inflammatories. I mean, there's a lot of different medications that aren't just opioids that we like to consider. And then there's intervention, so a lot of us are interventional pain management doctors, so we do procedures on the spine or in other places as well. So that's a large portion of what we do. And then think about referrals to surgeons if that's appropriate, but it's kind of a stepwise way of, escalating care as it's needed. But opioids are a minimal portion, of what we do.
Definitely, and I mean, and just in your personal, opinion and being a part of the pain management group, you really do feel like you all have set yourself aside.
Absolutely. Beyond just the physicians and the tools that we have, we also have a psychologist who we refer probably a large majority of our patients to, because it's hard to consider that someone has chronic pain every single day of their life, and they won't be affected by anxiety about it or depression from the things that they're not able to do that they used to be able to do. So we make sure that that's well taken care of. So that's one component. And then we also have a dietitian, and people are always a little bit surprised, but most pain conditions, there are dietary modifications that you can make, whether it be pro-inflammatory conditions where you would go and talk to ways to reduce inflammation in the body, but everything can be modified with diet to some extent.
I did not know that. Tonight,
Yeah,
that's something
absolutely.
I'm learning here myself. I find that very just intriguing. That's interesting.
Yeah, so I mean, she sees patients with really any kind of pain condition, as long as they also have diabetes, which is kind of one of the gateways to get into her. But then she assesses if it's weight loss that's going to help with your chronic pain, because that's extra stress on the bones, or again, if it's modifications to some of the foods that you're eating that could be making some of your pain conditions worse. She's great.
Do most places give those types of treatments? Is this something that really you can only find at the pain management group?
In Nashville, I believe we're fairly unique to have all of these things in one place. So.
I'd say so, yeah. I think that's really interesting to point out. We again appreciate you joining us tonight. We are going to learn a lot about tonight's topic. So moving on here, just a few talking points I wanted to cover. We kind of went over the overview of back pain from Dr. Reddy tonight, but let's talk about some of those causes. What causes this type of pain?
So when you break the back down fundamentally, there's a few things that can actually cause the pain. So people will always say, I have back pain, but the first question we as a doctor would have was, what's causing the back pain? So there's discs that can be causing pain, and then a lot of people will think about a disc bulge. So if a disc bulges back, it can compress some of the nerves or the spinal cord. So that's what causes, people always talk about sciatica and pain that runs down the legs. So that's commonly what would cause that. You can also have arthritis, and arthritis can cause pain when you extend your back backwards. Some of the bones will start contacting each other, and that can cause pain. The arthritis can also cause some bony overgrowth, which will also pinch the nerves and the spinal cord. So those are two ways, those are kind of the two fundamental ways that we think about it, but there's obviously a few more things in the back that can be causing the pain, but those would be the two main ones.
I mean, the causes, they can vary, really a broad spectrum for reasonings. There are, I see here, there are two types of injury in the spine. Can you tell us what those are?
So that would kind of be the two causes of back pain, would be either a disc-related pain or talking more about the arthritic type pain. People can have kind of wear and tear that builds up over time, and that's probably the most common thing that we see is arthritis that's just, living a hard life, working hard, and it's just built up over time, and you start seeing those patients later in life. Another type of injury to the spine would be something more acute, either a whiplash injury or falling, things like that, and that can cause an acute disc bulge. So that's probably where those two things fundamentally differ a bit.
All right, well, doctor, we're going to take a quick break, and we will be right back.
Okay.